My name is Jody Stafford. I'm a registered occupational therapist in the state of Florida. So I'm an OTRL. I'm primarily in the rehab settings. I focus my treatment area in home health, and I specialize in geriatric orthopedics and neurological disorders.
So tell me how you've used this for your patients.
The first person that I used it with was a neurological patient. He was a cerebrovascular accident. He had a blood clot in his brain. And he and I first started using it for problem solving, following directions, and fine motor coordination. And then once he got stronger, I was able to put weights on his arm and have him use the puzzle for dynamic strengthening in his biceps.
You solve the wooden Mentagy puzzle by placing the letter pegs in the grid, starting with A, going in alphabetical order from A to Z.
So it was about a total of 8 to 12 weeks.
Okay.
To work on every problem that he had. Cerebrovascular accident patients usually have a problem with both neurological and cognition. But if it were just a patient that was an orthopedic patient that needed strengthening, the puzzle could help a patient within 4 to 6 weeks. But if it was all a neurological patient, like multiple sclerosis or cerebral palsy or any other problem that affects the brain only, it would take about 6 to 8 weeks. You actually first have to decide what you're going to do. The brain has to decide what it's going to do, and then it has to problem solve, even through the damage. If you had a neurological impairment, whether it be a block or oxygen deprivation to the brain, it has to communicate something to the brain through an afferent. So the reason that I liked the puzzle with my patient is it worked on both pathways, and I could use my NDT treatments and the physical strengthening with my neurological patient, and it worked great. And he was my first test study with Mentagy on the puzzle that you gave me, and I had a lot of success with it. I discharged him, I think, within 12 weeks with all my goals met.
You mentioned there was some other patient you used. Could you just give an example of just one other patient that you used the Mentagy puzzle with, and explain how that worked out?
Okay, she was a patient that had fractured her humerus, her distal humerus. And during that time, she had a lot of muscle atrophy and disease atrophy. I used the Mentagy puzzle with her to promote her dynamic standing balance and use of her arm. With her as well, I started without weights, and eventually I was able to put up to a 5-pound weight at the end of treatment. A therapist could specialize it to work in all applications. You could use it in inpatient hospitals, rehab facilities, home health, psych hospitals. It's portable. It could go anywhere. It's easily adaptable to low-level patients and high-challenge patients. When I discharged him, he loved it so much, I was asked to leave it with him, and since I only had one copy of it, I told him where he could buy it, and I told him, unfortunately, I had to use the puzzle with my other patients. However, I was very glad that he enjoyed it so much and that it helped us in achieving our goals, and I got him in touch with you, and he was able to purchase one of his own, which was very nice. He still works on it today.
Good.